you've gone from OB to GYN, and now we're at the biostation.
I found there was huge gaps in the quality of medications we could offer. My patients that took regular hormones were content, but the patients on hormone pellet therapy were ecstatic. And that's when I stumbled across the biostation. When I saw the 3 pillars of biostation, the Defy Age, the Restore Beauty, and the Replenish Life, I said, this is really going to complete the gap that we are missing.
I said, this is it. We don't have to reinvent the wheel. Traditional medicine teaches us to label a problem with the disease, and then there are drugs to use to band-aid that disease. What we look for is the root cause of that disease.
Exactly.
And try and prevent it.
And there are a lot of conditions that the biostation treats that aren't considered actually diseases, but they're things that they're lacking, whether it's in their diet or whether it's in their other nutrition. Most doctors don't get training in that. There's many conditions that don't fall into a specific disease, but there are things that can be offered that can help make them feel better.